Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Dave back in here with us today, and this is Dave's second adjustment of the day. He came down here from Ohio on Sunday, right?
Yes.
And then came in yesterday as a new patient. And I wanted to use this video to tell you about the importance of doing a very thorough medical history on patients, because during Dave's history, part of his first visit, we discovered that he had had a heart attack back in 2009, correct?
Yes.
And that he had stents put into his arteries in his heart to open it up to get oxygen into the heart. What stents tell us clinically is that a patient has a condition known as atherosclerosis. Now, strokes are very rare with chiropractic adjustments. Barring what any medical doctor will tell you, the research done by medical profession has shown that strokes can happen to a patient sitting in a physician's reception area the same as it can happen from a chiropractic adjustment. So there is no real direct correlation showing that a chiropractic adjustment can cause a stroke. But as an extra sense of precaution with all of our patients, because our patients' health and well-being is the first and foremost priority that we have as licensed healthcare providers. We are to deliver safe and effective healthcare to our patients. And Dave came in from Ohio. I did that, and I stopped right at the point where we found that out. And I referred him over to a radiology facility that we work with here in Houston. And he went over there, and I ordered a ultrasound study of his carotid and vertebral arteries. The radiologist sent a report back to me saying that he was absolutely clear and did not have any plaque in his carotid or vertebral arteries, and that he was a candidate for cervical manipulation, which gave me the green light to do my adjusting on him. But I didn't want to do that on him because I didn't want to put him at risk first thing yesterday. So it's important for the healthcare provider that you're seeing, no matter whether that's an MD or a chiropractor, to do a really thorough medical history and evaluation on you to rule out contraindications to any kind of care, medical or chiropractic. And how did that come to you as a patient? What were your feelings whenever I told you that?
It goes to show you that you need to make sure you cover all areas of what you're trying to accomplish, and in the end, make sure it's safe.
Right. Mm-hmm. And you felt more reassured that we found that out and
Absolutely.
Checked you out for it, right?
Absolutely.
And we have that on other patients, and we have not adjusted them because if you have atherosclerotic changes, which is plaquing in the arteries, that plaque can break loose and travel up through the carotid or vertebral arteries into the brain, and that in and of itself can cause a stroke. We just don't want to do anything in our care that would precipitate that or encourage that. So I'm glad to see that he came back with a clear arterial picture, and he does not have atherosclerotic changes anywhere up there at all. So we adjusted him for the first time this morning. And how did that feel to you the first time you had the ring dinger done this morning?
It was amazing.
Compared to the other adjustments you've had in the past?
In the past, it's just a lot of twisting of the shoulders and hips, and that always gets you by for a month or so, and then you're right back at it again. And now I feel like I can stand without using extra muscles, and I'm more upright.
Without thinking about it.
Without thinking about it, yeah.
And you got some instant relief on that first adjustment this morning, didn't you?
Definitely.
I think that's the most common thread that most of our patients have seen. We got Dr. Maloney down here from Pennsylvania learning our technique and our history and examination procedures. He was in here yesterday. He got his first ring dinger yesterday. He did his first ring dinger on me yesterday. And I got one this morning. I'm going to have another one this evening before I go home. But, we're not just doing this for the money. We're doing this to help people's health potential improve in their function, and that's really why we're doing what we're doing. And it's very important for you to understand as a patient that your doctor needs to be doing a very thorough case history and evaluation on you before they accept you for care and put you in treatment. And that was pretty thorough yesterday, wasn't it?
Very thorough.
Yep. Okay, so let's show them how we did that then, Dave. I'll quit talking. Face the mirror. Let's have you flex your head forward and backwards for me, please, sir. And then back to neutral. Alright, so this being Dave's second adjustment, we're going to do the ring dinger first. We did the BioPhysics adjustment on him first this morning. Okay, let's do this one here first then, Dave. Lay on your back. And you can see now Dave's clear and he's team ring dinger now, so he's good to go. Slide up this way about 6 inches. That's good right there. By the way, we have a team ring dinger chiropractor up in Indianapolis, Indiana by the name of Dr. Terry Tolle, Tolle, and he is in Indianapolis, and that's only a few hours from where you live, right?
Yes.
So he can, we've referred Dave up there for follow-up adjustments with Dr. Tolle, and he's seen the same type of outcomes that we see in here doing the ring dinger on his patients. Oop, wrong way. Okay. Keep those teeth together. Breathe through your nose. Yes, sirree. That was even deeper than this morning's.
Yes, it was.
Probably wasn't as dramatic though as this morning's, was it?
No.
Tilt left. There, let me do it for you. There. So still adjusting his cervical spine, I'm still doing more of a P to A thrust than a rotational move in his cervical spine. Not because I'm worried I'm going to give him a stroke, just because that's the best way to adjust it. Yes, sir. Okay, let's lay you on your tummy now, Dave. Left leg's about 1/8 of an inch short, but not bad. Stays even there. Does that tighten up in your low back as much as it did this morning?
No, it's less.
Okay. I'm still going to adjust your pelvis first, though. There we go. Very nice. This should feel a little easier.
Mm-hmm.
Okay, good. You're gonna feel your head popping up on this next one. Yes, sir. Okay, let's turn you on your back, please. You can put your arms out if you want to. That won't hurt anything. Okay, now slide down about 1 inch and then put them both out. There you go. Okay, you can relax your hands right there. Yes, sir. I'm gonna ring and ding you from both ends. There we go. Okay, let's set you up and face that way today. This afternoon, I mean. You don't have as much crepitus in that right shoulder movement. This one's moving good too. There we go. Very good. Okay, let's stand you up here in front of the mirror and shoot you again. These out first. So this gun's a lot deeper in person too, isn't it, Dave?
Yes, it is.
You always hear the crack addict comments coming. What's that laser? What's that toy gun he uses? I don't do anything. There we go. Try that again.
Yes.
Very nice. So just to mention Dave's symptom when he came in, he had mid-back pain, upper thoracic pain, lower thoracic pain, low back pain, and right sciatica down into his leg and foot, neck pain stiffness, and right shoulder pain stiffness. And you've had 2 adjustments now. What would you share with our YouTube audience about your treatment here at Advanced Chiropractic Relief so far?
I feel a lot younger.
There you go.
I can stand up straight. Doesn't take as many muscles to stand up.
It's easier without trying. Huh?
Yes, I don't, it's hard to explain. It's just so much simpler. Standing up straight and moving freely is the biggest thing.
That's good. Did this meet with your expectations of coming here?
Yes.
And what we did for you so far?
Yes. I had a lot of pain between the shoulder blades, and that was my biggest
pain.
Biggest pain. Yeah, biggest thing I was trying to accomplish.
My biggest pain's Renee. See, she even laughs.
She's standing right there.
Yeah, yeah, I say it right to her face too. Well, listen, thank you for sharing your story with everyone. I know that's
Thank
personal,
you.
but you know we're here to take care of people's health. So if you want to come see us, go to advancedhoustonchiropractor.com and fill out a new patient request form, and Renee will get back to you within 48 hours. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Dave from Ohio. We'll see y'all soon.